players in this. And so I think that's going to be a very interesting panel. And then lastly, we're going to look at health records. You know, Microsoft and Google have gotten into the game, and all of us kind of scratch our head and go, okay, it's going to be easy to access, but is my privacy protected? So some of these questions, some of these areas are going to be addressed in these panels this morning. Most of the panels are going to be about 45 minutes long. There's going to be a good discussion from the moderators, and then you'll have an opportunity to ask questions at the end of the panels. Just want to give you a little preview of the afternoon. In the afternoon for Silvers, some of the takeaways there, we're going to be stalking the elusive boomer, so we're going to try to figure out how do they find out about products and services through the media. Do they read magazines? You know, magazines are going away, newspapers are going away. So are they in social networks? Are they out on the internet? A lot of people think that older adults don't use the internet. Fallacy. Anyway, so we're going to have an interesting panel with companies that have websites and printed media, and talk about what boomers buy and why, and how do they find out about brands. Another thing is technology drives us nuts. One of the problems I have here up on the stage is I have bifocals, and some of the print, you know, in changing these slides over, you know, I'm going to be down like this trying to get my bifocals adjusted. So we're going to have a panel on products, talking about why products are so hard to install. Sometimes they oversell expectations. So we're going to have a panel of companies that have well-designed products, and they're going to talk about what works and what doesn't work. And that ought to be fun, because Gary Kay, who's a journalist and an industry pundit and TV personality, will be up here conducting that panel. So I think it'll be a lot of fun. Now, all of us, especially if you're, say, over the age of 40, 45, are probably caught in a sandwich where you're trying to get your kids through college, get them out of high school, but now your parents are becoming elderly. Your parents are coming into a phase of their life where they need extra care. And so we're going to be talking about caregiving for mom and dad. And we use mom and dad. It could be an aunt, it could be an uncle, it could be a neighbor or best friend. But all of us come into a role as being a caregiver for an older adult. So we're going to talk about technologies that will deliver quality of life, communication, safety in their home, because people don't want to go into institutions. People want to age gracefully at home, in place, with their cat, their dog, their favorite pillow in the refrigerator, and the remote control. So this whole area is very complex, and we have some great thought leaders that will come up to the stage and tell you about this whole area. And then we're going to have a panel that talks about products that compensate for age-related issues, such as loss of hearing. You know, all those. I remember I had a 7-transistor radio when I was a junior high, and I had my earphones. I had that thing cranked up, so not different from the iPod kids today. All we had was radio back then, but it was enough to get us our tunes, let me tell you. So between that and going to a lot of car races, you know, you start to lose those frequencies here, especially after the age of 40. And did you know that cognitive decline starts at about the age of 45? So there's all kinds of things that technology can do to just kind of compensate for hearing loss, diminished sight, stress, And so this is an area where people kind of shy away from. But we have some of the leading companies that are making good products and great money in this area of age-related compensating products. So at this point, I would like to bring up to the stage our keynote. And our keynote was going to be, and if you look in your program in your bag, was going to be Bruce Henderson from PricewaterhouseCoopers. And unfortunately, Bruce's rotator cuff did not agree with this program or time, and he had to have his shoulder operated on, and his doctor grounded him from traveling. So we are very, very lucky to have Paul Ceverha from PricewaterhouseCoopers to come and join us today. And so let me tell you a little bit about Paul. Paul is the director in the Health Information Technology, and Health Information Technology is abbreviated to HIT. So if you're in this area of healthcare, you know that there's a lot of abbreviations. And so he's the director of the Health Information Technology practice of PricewaterhouseCoopers. Paul is a recognized thought leader in the HIT industry and has provided visioning and strategy and implementation and advisory services to his clients in the healthcare provider, life science, and healthcare payer sectors. He recently focuses and has been focusing on enabling healthcare business practices and processes through novel approaches and partnerships in healthcare informatics. So enough about listening to me. It's time to hear from Paul. So Paul, please come up to the stage.
Thank you, Susan. Good morning. I don't know how many college football fans there are here, but I happen to be in Pasadena on Thursday, so I feel a little bit like the freshman quarterback taking over for the guy whose shoulder went out. So I hope I do a better job than Garrett Gilbert did, because unfortunately that was my team that went down. So kind of an odd feeling, but it was a great event. So digital health obviously is a huge issue. Those of us who have been doing it for 15, 20 years probably never expected to read about this on the front page of the paper every day. And it's something that's getting a lot of attention. I think everyone in the Obama administration that's focusing on this thinks of healthcare IT as the opportunity to really reform health. And when you put $30 to $50 billion in your budget to transform the way health IT is done right now, that obviously gets a lot of attention. And so we're starting to see a lot of non-traditional players get involved in this. Let me pull up my slides here. I'm getting close to needing those bifocals too. Which one is it? Thank you. So what we're seeing is a convergence of change around three trends. Revolution in care, which is really just the development of new, innovative care models using new technology, a lot of that information technology. Regulatory reform, which is the drive towards care coordination with an emphasis on value and quality. Sounds like a good idea, right? How many people know what a never event is? Have you ever heard of that term? Okay. How many people knew that until last year, if you were a surgeon and you left your instrument inside of a body cavity, you would get reimbursed to go have the procedure to go take it back out? So, odd, right? And whatever complications arose as a part of that, you were reimbursed for that care. So something we're trying to get away from in healthcare. There's been a huge change in the way people are going to be reimbursed